I am Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. This video blog is on travelers' diarrhea. What is commonly known as Montezuma's revenge is often the punchline of a joke in the United States. However, travelers' diarrhea is a serious concern. It is the most common illness contracted by travelers and affects approximately 10 million people per year. Individuals visiting the United States can suffer from it as well. Although we tend to forget that fact, it provides a clue as to what actually is occurring with travelers' diarrhea. Travelers' diarrhea is typically a response to an infection by a strain of bacteria known as E. coli. Specifically, a toxin in E. coli affects the intestines. This is the case approximately 80% of the time. Sometimes parasites figure prominently in the illness. The risk and primary source of this infection is food or water that is contaminated with feces. Note that most any disturbance in the bacterial balance of the intestines can cause disruptions in the digestive system, leading to diarrhea. Anyone can contract travelers' diarrhea. However, destinations and personal characteristics can markedly increase that risk. Higher risk destinations include developing countries in Africa, Asia, Latin America, and the Middle East. Those individuals at higher risk include the immunocompromised, diabetics, young adults, and those with inflammatory bowel disease. Also, those taking antacids or medicines known as H2 blockers are also at increased risk. Travelers' diarrhea is straightforward. Symptoms typically include watery diarrhea and cramps. A mild fever may or may not be present. So what are you supposed to do to prevent travelers' diarrhea? It's miserable. Still, here are a few tips and pointers for you. Avoid street vendors. Try not to eat or minimize eating raw or undercooked foods, especially meats and seafood. Avoid raw vegetables and fruits unless you peel them. Always wash your hands. Taking antibiotics in advance is not recommended. Unfortunately, they can increase your susceptibility to resistant organisms and side effects. Bismuth subsalicylate reduces the incidence of travelers' diarrhea. Speak to your physician or expert consultant about the risk of indications of taking bismuth. By the way, you know this as Pepto-Bismol or kaopectate. Travelers' diarrhea is usually mild. Here are a few considerations about which you should be aware. It will typically run its course without medication. In other words, you're likely to be just fine. The most important consideration in travelers' diarrhea is to ensure that you're adequately hydrated. Clear fluids are key. You may need antibiotics if symptoms progress to include fever, bloody stool, nausea, vomiting, and severe cramps. Drugs given typically include ciprofloxacin and norfloxacin. Previously used drugs such as trimethoprim sulfamethoxazole and doxycycline are no longer recommended. Unfortunately, these drugs have a high resistance rate. In addition to its role in prevention, bismuth subsalicylate may also be used as treatment. Here's a special word about antimotility, also known as anti-diarrhea medications. There are some benefits to taking these agents, but there are also significant risks. You should not take these medicines without understanding the risk, how they may affect you based on your existing health profile, and a conversation with your healthcare provider. Look for additional content on Sphinx TV discussing steps you can take to assist you in your health journey. I'm Dr. Jeffrey, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. Thank you for watching. Be safe.